Senator Moore. Hello, everyone. Welcome. I'm Denise Provost. I represent the city of Somerville here in the House, and I'm pleased to see so many people turned out today for this significant event, which is a real milestone. Although I do not have the legislative experience of Senator Moore, back even before I was a lawyer, long ago. I was a researcher and editor for the American Society of Law and Medicine. And back in those days, these hospital-acquired infections were wrapped in a word that ensured non-transparency. They were called nosocomial infections, and so hardly anybody knew what you were even talking about if you referred to it. And people might speak discreetly about complications that someone might have stayed longer in the hospital to deal with, or might even have died from. But there was not a lot of public discussion about what this odd phenomenon was. And in coming here, of course, I found the perfect partners and opportunities for putting this knowledge into use. And I'm very excited by this report. I have the great honor of working with Senator Moore, who I consider a great mentor, on these issues in the last session. The instigation to create this report and the report on serious reportable events, and have two bills now that would push this work a little further. House 2138, which is the checklists bill that would mandate the use of checklists which are shown to reduce medical errors, have been developed by Boston's own Dr. Atul Gawande, who developed the surgical and intensive care checklists, and Dr. Paul Pronovost at Johns Hopkins, and House 2139, which is a bill I think that Senator Moore alluded to, that would mandate screening for patients at high risk for MRSA, which is the perhaps obscure acronym for methicillin-resistant Staphylococcus aureus, which is a very nasty infection that nobody wants to get. And we're working hard to try to make sure that is the case. I was excited to open the Globe this morning and see the news of the reports and what looks like a favorable trend for Massachusetts, both because it's good in and of itself and because it will draw public attention to this and get into the feedback loop, I think, so that when people are looking around for a place to, say, have an elective surgery, they will be paying attention to things like infection rates. And the success of Massachusetts and of Pennsylvania, which is another state which is aggressive about reporting requirements